Today I'm going to talk about ablative CO2 resurfacing. So there's different types of resurfacing out there. Microdermabrasion, other things that abrade the skin, but ablative CO2 resurfacing is the most effective way to get new skin that is either sun damaged, wrinkled, keratoses, any aging of the skin can be improved. Pretty much any aging of the skin can be improved with ablative CO2 resurfacing. There's also the Fraxel CO2 laser that makes little holes in your skin, punches little holes in your skin, with the idea being that as the holes close, they tighten the dermis and improve the appearance of the skin. I don't think it works very well. The advantage of the Fraxel, the stated advantage given by the laser companies and doctors that use that laser technology, is that it heals faster. I will grant that is the case. It does heal faster. However, most of my ablative patients that have ablative CO2 resurfacing are also having something else: a segmental endoscopic brow lift, a SUF lift, blepharoplasty, a deep plane lift, something other than just the ablative CO2 resurfacing. Although there are certainly plenty of patients that I've had over the last 30-some years who have come in and just done a full face ablative CO2 resurfacing. Regardless, all those patients that have that procedure, the ablative procedure done, take 10 to 14 days to heal before they can start wearing sunscreen and makeup. And then they go through what we call an erythematous period, which can last anywhere from 6 weeks to 3 months. Their skin kind of looks like it's been too much wind, or just a little reddish. It's pretty easy to hide that issue with appropriate makeup. When they're in that phase, the most important thing, other than makeup, because most ladies don't want to run around looking with their skin looking a little red, is the sunscreen. They can't get excessive sun to their skin when they're in the erythematous phase, because the skin is young, new, and would be more susceptible to injury by the sun. As long as they wear their sunscreen, it really doesn't matter when they do it: winter, summer, spring, or fall. They just have to wear their sunscreen. So the reason I like ablative CO2 resurfacing is that it's very high-tech technology. It actually turns the epidermis. The skin consists of the epidermis and dermis. Dermis is divided into two layers, papillary and reticular. So with the ablative resurfacing, you're actually removing the epidermis with minimal, very little micron thermal damage to the papillary dermis. And then the dermis provides the new epithelium, or epidermis, for the areas that have been resurfaced. That process of reepithelialization, or the growing back of the new epidermis, as I said before, takes around 10 to 14 days. It's an effective, very patient, well, I wouldn't say friendly, but friendly in that patients are very happy with the results, procedure. And if you'd like to learn more about it, you can go to either my website and look up ablative CO2 resurfacing. You see lots of patients, photos, pre and post-op. Also, we have a section on Instagram, TikTok, all those new fangled ways of communicating that I'm becoming more and more familiar with on ablative CO2 resurfacing. But the best place to go would be my website initially.